Thank you for the introduction and thank you for the opportunity to present our work. This study received funding from SAGES, FRQS, and CSCRS research grants. Low anterior resection syndrome, or LARS, is an important sequela of restorative proctectomy that affects a significant proportion of patients post rectal cancer surgery and is associated with poor quality of life. Although symptoms are believed to improve in the first 1 to 2 years after surgery, longitudinal studies have shown that symptoms may persist up to 15 years post-resection. There's no evidence-based management algorithm for LARS, and its management is very individualized and symptom-based. And a lot of individuals living with LARS report feeling anxious, isolated, and hopeless in association with their symptoms. Peer support could be an important psychosocial intervention for individuals living with LARS, helping to normalize and validate their experience. Peer support refers to a supportive relationship among individuals who share common experiences or face similar challenges, and has been associated with positive both physical and mental health outcomes among individuals living with chronic disease like asthma, diabetes, or IBD. Given that people living with LARS may experience some difficulty with in-person gathering, the online platform may be a more convenient option, and the online peer support option also offers additional benefits like anonymity and 24-hour access. We designed a parallel groups, multi-center, randomized controlled trial, recruiting participants from 5 major colorectal practices across Canada. We hypothesized that the use of an online LARS peer support app will be associated with improved quality of life. Our primary outcome of interest was global quality of life as measured using the EORTC Quality of Life questionnaire, and our secondary outcomes included bowel function as well as depression and anxiety, both measured using prompts that were previously validated for use in rectal cancer patients. We also aim to describe the proportion of participants that met criteria for adequate app usage that was predefined, and our study was powered to detect a 10-point difference in global quality of life score, which is the cutoff used to signify minimal clinically important difference. The study trial protocol was registered before the study launch, and the protocol was published in a peer-reviewed journal. And our inclusion criteria were people who underwent restorative proctectomy for rectal cancer in the last and completed all treatment for rectal cancer in the past 3 years, and were found to have major or minor LARS as defined using the LARS score. Our main exclusion criteria were active treatment for rectal cancer, inability to comprehend English or French, and lack of appropriate interface to access the app, such as a tablet, a smartphone, or computer. Randomization was performed by the lead site, and participants were stratified by time from proctectomy as well as the site they were recruited from. And the intervention group received access to the online LARS peer support app for a period of 6 months, and the comparison group received by mail a LARS educational booklet that contained the same educational content as the app. We recruited 1 to 2 peer support mentors from each site for a total of 7 peer support mentors. These are individuals who also underwent rectal cancer surgery and have had some experience in managing their own LARS symptoms and were motivated to help others. And these mentors were recruited by their referring physicians. All peer support mentors were required to attend 2 mandatory online training sessions that were led by certified peer support mentor, colorectal surgeon, trained LARS nurses, and counseling psychologist. Due to delays in ethics approval across other sites, we decided to run the trial in 2 waves. The first cohort consisted of participants recruited from 2 hospitals in Montreal, Canada, and the second cohort consists of people recruited from 3 hospitals across Toronto and Vancouver. Of the 202 participants that were eligible and approached for the study, 101 participants consented and were randomized. 10 participants were lost to follow-up and did not have the prompts to be included in the final analysis. So in total, 91 participants completed the study and were included in the final analysis. The groups were well balanced in terms of their baseline characteristics, their disease and treatment characteristics, as well as their baseline bowel function and global quality of life scores. And the participants in both groups received the baseline questionnaire 2 weeks prior to the study launch, at 3 months, and at 6 months upon completion of the study. This is the homepage of the app. Only participants who received a unique username and password through their email were able to access the app during the study duration. And this is the homepage of the app with the profile page and the homepage that's displaying the 3 main features of the peer support app, which were the Lars educational module, the peer support forum, that was the highlight of the app, and the Lars diaries. One of the most popular features of the discussion forum were short video clips lasting 1 to 2 minutes each, covering topics that were requested by the participants. And they included topics like perineal skincare, pelvic physiotherapy, diet and Lars, and interviews of peer support mentors who volunteered. And as you can see, the videos elicited rich discussion around each topic. And this is an example of a forum post, as well as replies to the forum posts. And the forum itself was moderated mainly by the peer support mentors, and the Lars research team, including the colorectal surgeon, Lars nurses, our research associates, monitored the app on a regular basis to answer any questions that required specific expertise or clarifications. We also held live chat nights on the app, where all the participants logged into the app for a duration of 1 hour and discussed topics of interest. And we held these live chat nights on a regular basis on the app to engage the participants. Here's some numeric data generated from our app. So there were over 2,300 app logins among the 45 participants across 5 sites. 25 videos were posted, and there were over 180 forum posts with over 2,000 forum views among participants. And we held 4 chat nights with over 500 live messages that were exchanged throughout the chat night. Among the 45 app users, the median login per person was 21. There were 4 participants who never logged into the app, and 30 participants met criteria for adequate app usage, which was defined as more than 4 logins to the app per month consecutively over the duration of the study, which was 6 months. We first performed an intention to treat analysis looking at quality of life, Lars, and anxiety depression scores pre and post intervention. Although we saw a trend towards improved quality of life, it did not reach statistical significance. And on the per protocol analysis, where we only included in the app group those participants who met criteria for adequate app usage, we saw that the use of the online peer support app was associated with improved quality of statistically significant improved quality of life and Lars scores. And we also observed a greater than 10-point improvement in global quality of life score in the app group when comparing their pre- and post-intervention average scores. Again, this was defined, the cutoff used to define minimal clinically important difference. So to conclude, this was, to our knowledge, the first prospective multi-center North American trial to report short and long-term functional and quality of life outcomes among rectal cancer survivors living with Lars. And given the significant proportion of individuals living with Lars post-restorative proctectomy, this study contributes important knowledge to further guide patient-centered care. And the tested intervention, the Lars online app, is readily accessible, and it is relatively easy to implement across large range of geographic jurisdictions and settings. Thank you for listening, and I'd be happy to answer any questions.